a question from the audience where they asked who is actually responsible for informing the public regarding the importance of keeping up with treatments and appointments with the doctor. Should there be the government that pushes for it by awareness campaigns or even social media campaigns? Should it be on pharma? Should it be on the clinician and the healthcare provider and the system? Is this something that you think would be a way to approach this? I know that we had a example from Dr. Antonio Callis, where he said that in Spain, the clinician actually tweets, and they have social media influencers who retweet their tweets to bring awareness, to make sure that, come to the clinic, check your screening, and make sure that you follow up with treatments and all these things. Is this something that you think would work in the States? Is something that you think?
A couple of comments. And this is difficult, and we don't have an hour because it's going to take an hour for me to expound upon this. This is not how science works. Science is an iterative process. We learn, we learn, we have a thought, we have a hypothesis, we do tests, we find out some of what we thought was right, some of what was wrong, we do another test. And again, what I'm saying, for those who understand science, this is obvious, but it's problematic when things change on a daily basis. It's problematic when science and politics get linked together as they have. And these are just facts. What one knew on March 13th is very different than what is known on April 13th, et cetera, et cetera. We learn. And if one wants to attack the process, so be it. The process can't change. And therefore, it's very difficult for a definitive statement to ever be made, certainly in prospectively. Retrospectively, we can look back and say, well, we actually understand how the plague worked hundreds of years ago. But we couldn't, even then, we couldn't have done it at the time because it wasn't known. And again, I'm being only semi-facetious here. The fact is that, but that is science. So someone says something today and 6 months later they change it. That's not a political change. We learn more. And so, science can only be part of this. It cannot be the solution. And by the way, you try to explain science, the complexity of science is just not going to happen over a short period of time. I think this is really important to understand. So my answer, you need the groups that are trusted, the American Cancer Society, American Society of Clinical Oncology in the United States, and very, very, very importantly, patient advocacy groups. Patient advocacy groups speak for patients. And again, there's so many patient advocacy groups, as there should be, because there are multiple different groups, multiple different diseases, et cetera. But if these groups working together speak a language that is both thoughtful, reassuring, demanding of, are people going to wear masks, et cetera, working with groups like the American Cancer Society, American Society of Clinical Oncology, various other groups. So I just mentioned these because the groups I are dear to my heart, but there are certainly many others. And really together take to the streets, not literally, but, social media, to just basically give a message of, I think that'll be critically important as we move forward.